Here at the Poison Center, primarily I think what we do is help people when something happens. So their child gets into something and eats something that they shouldn't. Someone intentionally takes something to harm themselves. So we're really here for the public and then also for hospitals once patients are there in the emergency rooms with those sorts of exposures.
We are providing expert consultation and care for all of the state of Wisconsin. And whether it's a mom who's worried about their child at home calling us or a physician who needs our help managing a case, that's what we're here for.
A SPI is a specialist in poison information, so we can be nurses, pharmacists, sometimes even doctors, and what we do is we manage the Poison Center hotline, which is a 24/7 hotline where people that are healthcare professionals or members of the public can call us and ask us questions about potentially toxic exposures or information about poisons or other toxins. When a call comes into the Poison Center, one of the specialists will pick up the phone and what we do is gather a lot of information about the call. So sometimes we'll be asking a lot of questions about the name of the person calling and getting demographic information if it's related to an exposure for someone. And what we do with all that information, it's all coded and uploaded continuously into the National Poison Data System. So that can be used to track trends in poisonings.
Poison Center? I'm really worried. I just took some of my husband's medications. What should I do?
The National Poison Database System sweeps all the poison centers for their data. And if we start to see a sudden uptick in number of cases that a poison center is managing, that can signal that there could potentially be a new outbreak occurring in that area. Our mission is really twofold, helping take care of patients. We also provide a significant amount of education to the public so that people can help reduce their exposures.
We use a couple of different methods for education. We have a public education website where we provide information to parents, to older adults, to all of our different populations. We have brochures that we provide. We do radio advertising. In some circumstances, we did a campaign where we put information on the side of transit buses. It just depends on which population we're trying to reach. I do most of the public education to promote the awareness of the Poison Center. Parents of young children today are not the same individuals that are going to be parents of young children 10 years from now. So we constantly have to be educating because those populations change. How can we remind them of the service? We have a great service. It's free to everybody in the state of Wisconsin, but if they don't know to call us, then they're not going to use it.
Most of the people that are hired at the Poison Center don't always come from a background in toxicology. Usually it's healthcare providers that are coming from maybe an emergency medicine background. That's a common place that we have a lot of our staff. But then we take a 12-week orientation to learn about the management of all the toxicities of the substances that we get called about.
We do a lot with teaching with the pharmacy and the medical students and the residents that are here. Toxicology is really complicated. It's a great opportunity for them to learn from the toxicologists that we have on staff.
A medical toxicologist is a physician who has specialized and then subspecialized in poisoning and overdose and diagnosis and management of poisonings. Medical toxicologists and poison centers are inexorably linked, meaning that they can't live without one another. In order for a poison center to exist and be accredited and fully acknowledged as having the expertise that it should have, they're required to have medical direction from a medical toxicologist. There are only about 400 board-certified medical toxicologists in the world. We're really fortunate to have 5 medical toxicologists here and 3 clinical toxicologists as well supporting the Poison Center. So I think the Poison Centers provide an unbelievable service to the public.
I think the center has a lot of impact, not only for the care that we provide for the people in the state, but also the people that we're educating here. They're coming out with a specific knowledge base and going out into the world and using that to help better care for patients.